Hello friends, the question is when not to take homeopathic treatment for psoriasis. Yes, there can be circumstances that you should not take homeopathic treatment for certain conditions or certain period of a time when you have psoriasis. For example, lot of patients comes to me that they have very severe psoriasis and they need that they should be treated in a short period. They need relief 2 months, 3 months, because they have a marriage, they have a function, they have an exam, physical exam, and they have to appear for that. Definitely, they should not take treatment if they want a result that is a definite and in short period they want a relief. All those people I always advise that homeopathy cannot always help you, and don't take risk and don't waste time in such an emergency. First of all, if you want to take a treatment, you be ready that at least for 1 year you can continue, and you can wait for some time to get the results. 2 3 months it may take to get a results, or it may take 1 year for complete recovery. If you have time and you have space and if you have patience, then only take, and if you don't have, don't take. If you expect that, it's a clear cut my personal opinion for the patients. Second thing, many a times it happens that a patient comes to me and he has psoriasis, and suddenly we notice that especially the psoriasis on feet and legs, it is there, and because of secondary infection, its wounds are there and he itches, or some infection comes from outside, and there is a cellulitis, a disease called as a cellulitis. His legs get swelled and he starts fever, chill, and we call it a early stage of cellulitis. And at this stage, definitely I don't advise the patients to go for homeopathic treatment, because there is a chance that if the cellulitis increases and the infection goes in a system, he needs to be admitted. So to avoid the emergency, as soon as I notice that there is a cellulitis, I advise him, don't take it, go take allopathic treatment, go to antibiotics, control the infection first, because there is a risk beforehand, because it can cause very severe inflammation, severe infection, and it can cause gangrene also. So we don't take a risk in that. We definitely, even our patients, we advise go and take allopathic treatment, antibiotics, go to dermatologist, go to hospitals, get it admitted, and control that episode. Third situation, when we notice that patients with psoriatic arthritis come to us. If it is a mild psoriatic arthritis, definitely we can start the treatment and we try to control it. We give some exercises so that joints do not fuse. But sometimes it is very severe and joints start fusing. At that stage, we don't want the patient to get these joints deformed, because it will take time for psoriasis results for homeopathic treatment to control it. At that time, we ask the patient that you have to control the psoriatic arthritis with the treatment of modern science, so that you can move your joints and you can start both the treatment at the same time. So as soon as our treatment will take over that, and gradually we'll taper down the treatment of modern science, and we'll shift you completely to homeopathic treatment. But for some time, to save your joints, I think it's better that you take a compromised treatment of both sciences, and that is the best for the patients. Because many a times my fellow doctors or even the doctors of modern science can criticize me for this, that you cannot treat psoriatic arthritis severe. Yes, I cannot treat psoriatic if it is severe, because I don't want to compromise the joints of the patients get deformed, and I need your help for that. But afterwards, once my medicines start controlling the joints, gradually the medicines can be tapered and he can shift complete to homeopathic treatment. So that is one of the things that you should not 100% be dependent on homeopathy, because it's not the question of my medicine is best or the modern medicine. It's the question of how best I can help the patient and how best I can save his joints. So these are the conditions where you should not take. Last and very important, if you are not ready to wait, if you are not ready to cooperate with the doctor, if you don't trust the doctor, it may take 1 or 2 years more for you, because we don't know how much you respond to. And there can be possibility, rare possibility, some patients may not get well with homeopathy even. I may not be able to help all patients. I humbly agree that there are some patients I really can't help, that I accept. But if you are ready to cooperate with me, it may take a little more time. But if you give me the fixed time, doctor, I want to get in 1 year, I want to get in 2 years, sorry. If you give me the time, sorry, I won't give you the treatment. Find another doctor or you then go for homeopathy. Thank you.